Assalamualaikum warahmatullahi taala wabarakatuh. For subject MRD 550 radionuclide imaging, our group will be discussing about 18F fluorodeoxyglucose, or commonly known as FDG, and 18F choline, and also its application in PET and PET CT scan. First and foremost, I would like to introduce my team. First, myself, Muhammad Anas Fikri bin Abdul Rashid, matrix number 2023224338. Second one is Ahmad Kamil bin Haji Abdul Rahman, matrix number 2023281788. And finally, Muhammad Taha bin Hamidon, matrix number 2023475704.
Okay, now I would like to present about indications of the 18F fluorodeoxyglucose, commonly known as the FDG for a PET and PET CT. So, firstly, for the oncology, the diagnosis of detections and categorizations of tumor. PET scan can identify area of increased metabolic activity typical of cancer cells. This help in detecting tumor, especially in area difficult to visualize with other imaging technique. So second is differentiate between benign from malignant lesions. Since malignant tumor is typical with higher glucose metabolism compared to benign tumor, the FDG can help to differentiate between these. So next, for staging, assessment of disease spread, a PET scan are crucially in determining the extent of cancer spread staging, which is vital for treatment planning. They are particularly useful for cancer like lymphoma, lung, breast, colorectal, and melanoma, which accurate staging significant impact treatment decisions. So last but not least, for the detections of metastasis, the PET scan can detect a mets in organ like a liver, lung, bone, lymph nodes, which might be missed on conventional imaging. So next is the treatment planning. The biopsy guidance, a PET scan can guide a biopsy to the most metabolic active and a diagnostic valuable area of tumor. So the radiation therapy planning, PET imaging help to define the target area for the radiation therapy. Ensure the maximum dose to the tumor while sparing the healthy tissue. So next, the response assessment. Monitor treatment effectiveness by compare a pre and post treatment. PET scan. Clinician can assess how well a tumor responds to therapy. So next, the early detections of treatment response or resistant. PET scan can reveal early sign of whether a treatment is effective or if the cancer is resistant. Allow for timely adjustment to the treatment plan. For the surveillance, detections of recurrence after the treatment, regular PET scan can help detect a cancer recurrent before symptoms appear, or other imaging technique can identify it. The evaluations of residual disease, the PET scan can distinguish between a scar tissue, and active disease post-treatment, guiding further management. Indications in neurology is epilepsy. First one is epilepsy. So the localizations of epileptic foci, PET scan can identify area of the brain with abnormal metabolic activity associated with a seizure activity. which is essential for planning surgical interventions in refractory epilepsy. So next indication is dementia. PET scan can help to differentiate Alzheimer's disease from other type of dementia based on distinct a pattern of brain metabolism. Besides that, the assessment of brain metabolism and function, PET scan can provide the information on the metabolic activity of different brain region, which can assist in diagnosis and managing neurological conditions. Okay, now we go through for the indications in cardiology. The first one is a myocardial viability. Determine a viable myocardial tissue in patient with ischemic heart disease. A PET scan can assess a myocardial viability to determine if there is living tissue that could benefit from the revascularization procedure like angioplasty or bypass surgery. So beside that, for the inflammations and infections, PET scan can identify or detect site of infections or inflammation within the hearts or blood vessels. We example is a vasculitis. So for fever of unknown origin, PET scan can help identify the source of unexplained fever by locating hidden infections or inflammatory process. In inflammatory disease, PET scans are useful in detecting and monitor inflammatory conditions such as sarcoidosis, rheumatoid arthritis, and inflammatory bowel disease. So for the other indications of FDG, the sarcoidosis. The PET scan can assess the extent of the activity of sarcoidosis, guiding a treatment decision. Next is a vascular prostatic infections. PET scan can detect the infections in prostatic vascular graft, which is critical for appropriate management and treatment. Okay, so next we will explore the use of F Choline, PET and Pet Ct in oncology, with a specific focus on applications in prostate cancer. The F Choline is a powerful imaging technique that helps in diagnose and localizations of prostate cancer. Okay. So the 18F Clean PET and Pet Ct is highly useful in detecting a primary prostate cancer. It is especially beneficial in cases where other imaging modality like MRI, CT scan may be inconclusive. By highlighting area of the increased choline metabolism, it help in identify cancer tissue within the prostate. So next, for the localizations of tumor within the prostate, accurately locating the tumor within the prostate gland is crucial for effective treatment planning. 18F Choline PET Ct help pinpoint the exact locations of the tumor, assisting in target of biopsy planning and improving diagnostic accuracy. So next we go to the staging. For the initial staging, when the prostate cancer is newly diagnosed, determine the extent of the disease is essential. 18F Choline PET Ct is useful for initial staging. So helping to detect a lymph node involvement and distant metastasis. This information is vital for selecting the appropriate treatment strategy. So, okay. Beside that, one of the key strengths of the F Choline is the sensitive detecting a lymph node metastasis. It can identify metastasis for the lymph nodes that are not enlarged and might be missed by conventional imaging technique, thus providing a more accurate assessment of the disease spread. So next we go to the restaging, a biochemical recurrent. After treatment of the prostate cancer, such as a surgery or radiations, monitoring for recurrent is crucial. A rise in a prostate-specific antigens level can indicate biochemical recurrent. 18F Choline Pet Ct is instrumental in localizing recurrent disease, guiding a further treatment decisions. For the detection, next is a detections of a residual or recurrent disease. F Choline is effective in detecting residual or recurrent prostate cancer. It can identify a local recurrent in the prostate bed and distant metastasis, such as those in the bone or lymph nodes. This comprehensive detection capability aids in time and targeting interventions. Okay, now we discuss about the role of the F Choline treatment planning and monitoring for the prostate cancer, as well as its application in other cancers such as hepatocarcinoma and brain tumor. So firstly is the treatment planning and monitoring of prostate cancer, but the guiding salvage therapy. So the 18F Choline Pet Ct is instrumental in planning salvage radiation therapy for the prostate cancer. By accurately localizing recurrent disease, it helps in targeting the radiation precisely, which can improve the effectiveness of the therapy and minimize damage to surrounding healthy tissue. So beside that, monitoring response to therapy is evaluate the response to the treatment is crucial in managing a prostate cancer. 18F Choline, a PET CT can assess changes in choline in uptake, providing valuable information on the effectiveness of treatment such as hormone therapy, chemotherapy, and radiation therapy. This helps in making timely adjustment to the treatment plan if needed. Okay, next is application in other cancer, hepatocellular carcinoma, the detections and staging. The 18F Choline is a PET CT is also useful in detections and staging of hepatocellular carcinoma, which is a HCC. It can identify primary HCC and its metastasis, particularly in a patient with inconclusive finding on other imaging modality. This assists in accurate staging and guide treatment decisions. So, next is applications in other cancer, a brain tumor. Differentiate a tumor recurrent from a radiation necrosis. In patient with a gliomas or other brain tumor, distinguish between recurrent tumor and radiation-induced changes is challenging but crucial. 18F Choline PET CT can help differentiate between these conditions, providing essential information for appropriate treatment planning. Last but not least, the clinical relevance, the ability of the 18F Choline PET CT to detect metabolic changes in a various cancer make it a versatile tool in oncology. It not only aids in accurate diagnosis and staging, but also play a vital role in the treatment planning and monitoring, ensure that the patient receive the most effective and personalized care. Okay, now for the indications of a non-oncologic, the hyperparathyroidism. The locations of the parathyroid adenoma can be used in a patient with a primary or secondary hyperthyroidism to localize hyperfunctioning parathyroid gland, especially when other imaging are inconclusive. Okay, now we go to the radiopharmaceutical for the 18F fluorodeoxyglucose, which is known as FDG. So what is the 18F FDG? 18-FDG is a radiopharmaceutical that combines a glucose analog, a deoxyglucose, with the radioactive isotope fluorine-18. These combinations allow us to visualize the metabolic activity in the body using the PET scan. So now I want to explain about the mechanism for the cell uptake. First, let's discuss how 18-FDG enters cells. FDG is a transport into the cell via glucose transporter, which are proteins that facilitate a glucose entry into cells. These transporters are particularly active in cells with a high metabolic rate, such as cancer cells, brain cells, and inflammatory cells. So, besides that, the phosphorylations, once inside the cells, FDG is phosphorylated by the enzyme hexokinase to form FDG6 phosphate. This step is similar to the first step in a normal glucose metabolism. However, unlike a glucose 6 phosphate, FDG6 phosphate cannot proceed further down the glycolytic pathway. This difference results in the trapping FDG6 phosphate within the cells. For the accumulations, the accumulations of FDG6 phosphate within cells is directly proportional to their metabolic activity. Tissue with higher metabolic rates, such as a tumor, brain regions, and inflamed tissue will accumulate a more FDG. This characteristic make FDG an effective marker for identify area of high glucose metabolism. So for the radioactive decay, the fluorine F isotope in FDG undergoes the radioactive decay, emitting a positrons. These positrons travel a short distance before collide with electron, resulting in annihilation event that produce pair of gamma photons. The PET scanner detects this gamma photon and construct image showing the distributions of FDG in the body. Okay, now we will be discussing the radiopharmaceutical 18F Choline and its applications in the Pet Ct scans. This technique is particularly useful in imaging certain cancers such as prostate cancer due to its ability to highlight area of increase of cell membrane synthesis. What is 18F Choline? 18F Choline is a radiopharmaceutical that combines choline, an essential nutrient involved in cell membrane synthesis, with the radioactive isotope fluorine. These combinations allow us to visualize area of high metabolic activity in the body using a PET scan. The mechanism of cell uptake. First, let's talk about how 18F choline enter the cells, choline transporter. Especially choline transporter, like a protein 1, CTL1, facilitates the uptake of 18F choline. These transporters are highly active in cells that are rapidly synthesizing membranes, such as cancer cells. This increase in transporter activity leads to higher uptake of 18F choline in these malignant cells. The mechanism of phosphorylations. Once inside the cells, 18F choline is phosphorylated by the enzyme choline kinase, forming a phosphorycholine. This step is crucial as phosphorycholine is a precursor in the synthesis of phosphoritidine, a major component of cell membranes. In many cancers, there are overexpressions of choline kinase, leading to increased conversions of choline to phosphorylcholines. The mechanism of the incorporations into cell membranes. Phosphorylcholine is a further process and incorporated into the phosphoritidylcholine, which then used to form and repair cell membranes. Cancer cells which are rapidly dividing and invasive required more photo phos- phosphatidylcholine, leading to higher incorporations and retentions of 18F choline in these cells. The mechanism of radioactive decay. Fluorine 18 Fluorine 18 and 18F choline undergoes radioactive decay, emitting the positron. This positron travel a short distance before collide with the electron and result in annihilations event that produce pair of gamma photons. The PET scan detect this gamma photon and construct images showing the distribution of 18F choline in the body.
Assalamualaikum and welcome to this brief presentation on PET and PET CT scans using 18F fluorodeoxyglucose or FDG and 18F choline. Today, I will be covering radioactivity administered, patient preparation, and the colorimeter used in PET and PET CT scan. My name is Ahmad Kamil bin Najib Rahman. My student ID is 2023281788. First, let's discuss the purpose of 18F FDG. 18F FDG is a glucose analog image metabolic activity, especially in tissues with high glucose uptake, such as cancer cells, and it is commonly used in oncology, neurology, and cardiology. Meanwhile, 18F choline, primarily for prostate cancer imaging and other tumors where choline metabolism is increased. It usually administered via intravenous injection, and the dosage of radiopharmaceuticals varies depending on the tracer and the clinical scenario. For 18F FDG, the typical dose ranges from 185 to 740 megabecquerels or 10 to 20 millicuries. This dose is chosen to ensure optimal imaging quality while minimizing radiation exposure to the patient. For 18F choline, the administered dose usually ranges from 185 to 370 megabecquerels or 5 to 10 millicuries. The exact dose can depend on factors such as body weight or patient size and the specific PET CT scanner being used and also the diagnostic requirements. Accurate dosing is crucial for obtaining high quality images and ensuring patient safety. Next, we are talking about patient preparation guidelines. Number one, to obtain informed consent after explaining the procedure, its purpose, and the potential risks to the patient. And this may also to provide an opportunity for the patient to ask any kind of questions. And patients should arrive at the facility at least 30 minutes before the scheduled appointment to complete any necessary paperwork and preparations. For the female patients, they should inform the healthcare provider if they are pregnant, planning to become pregnant, or breastfeeding, as this is the special precautions that might be needed. For the allergies and medical condition, patients should inform the healthcare provider if there's any allergies or medical conditions, particularly the one have kidney issues or claustrophobia, as this may affect the procedure or require special accommodations. During the examination, patient need to stay relaxed and breathe slowly throughout the procedure. To take a note, patient preparation are the key for the successful scan. Next, let's talk about patient preparation prior PET and PET CT scans, which is essential for the accuracy and the quality of PET and PET CT scans. For 18F FDG scans, patients are typically required to fast for 4 to 6 hours before the scan. This fasting period helps to lower blood glucose level, ensuring that the radio tracer is taken up more effectively by target tissues. Patients are also advised to avoid intense workout before the scans to prevent increased uptake of the FDG in the muscles. Hydration is really encouraged, and patients are often asked to drink water to help eliminate excess stress through the kidneys and the bladder to reduce background noise in the images. For 18F choline scans, specific dietary restrictions may vary, but hydration is similarly important, and patient might also be asked to empty their bladder before the scan to reduce radiation exposure and to improve image clarity. After the scans, patients are encouraged to drink plenty of fluids to help flush the radio tracer from the system. We also advise patients to avoid close contact with the pregnant woman and young children for a few hours after the scan due to residual radioactivity. Finally, let's discuss the type of colorimeter used in PET and PET CT scans. A colorimeter is a device that filters a stream of rays so that only those traveling parallel to a specified direction are allowed through. In the current PET detector, we are using electronic colorimeter, and inside the electronic colorimeter, it can filter out unnecessary ray. Basically, there is no physical colorimeter. In PET imaging, high energy colorimeters are used, and these colorimeters are designed to handle the high energy gamma rays emitted by the radio tracers. They play a crucial role in minimizing scatter and improving image resolution. The use of high energy colorimeters ensures that the images produced are accurate and detailed, allowing for precise localization and characterization of metabolic activity within the body. This is particularly important in detecting and monitoring diseases like cancer. In summary, understanding the radioactivity administered, patient preparation, and the type of colorimeter used are essential components of PET and PET CT scans techniques. These elements work together to ensure high quality imaging and accurate diagnostic information. Thank you for your attention. I hope this presentation has provided you with a clearer understanding of this important aspects of PET and PET CT scans.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. My name is Muhammad Anas Fikri bin Abdul Rashid. Now I would like to talk about image acquisition in PET scan. Positron emission tomography or PET scan is a nuclear medicine technique using a camera that captures image of how the human body function. The compounds that normally exist in the body, as for example, simple sugars, they are labeled with radioactive tracers and they are injected into the body intravenously, and then the tracer emits signal which are recorded by the scanner as the tracer travel through the body and all collects in the targeted organs, and then a computer resembles the signal into actual images showing biological maps of normal organ function and failure of organ system in the disease. The basic steps of PET imaging include radioisotope production, radiopharmaceutical chemistry, tomography acquisition, and image reconstruction. PET CT scan or positron emission tomography, computed tomography are advanced imaging technique used to detect and monitor diseases, particularly cancer. PET CT combines metabolic imaging from PET scan with anatomical imaging from CT scan. The fusion allows for precise localization of metabolic activity within the body anatomical structures. The first thing a low dose CT scan perform for anatomical details, and then second, the PET scan are scanned for metabolic or cellular activity, and then the combines the functional data from the PET scan with anatomical data from the CT scan, and then data from both scan are fused together for comprehensive images that show both metabolic activity and anatomical structures, and then the image are reconstructed. Advanced algorithm reconstruct the PET image from the raw data, correcting for factors like attenuation and scattered. And then for quantification, the standard update values are calculated to quantify traces update. This is illustration scanning a PET scan using FDG. FDG uptake. FDG is taken up by cells in proportion to their metabolic activity, highlighting areas of increased metabolism, and hybrid imaging of PET CT scan provide both functional and structural information, improving diagnostic accuracy. First of all, patients position in the scanning table, usually supine, and then scan performed approximately 60 minutes post-injection, and the whole body scan typically takes 20 to 30 minutes. Following FDG injection and uptake, the patient is positioned for the CT scan and the scan image is acquired, usually about 10 seconds, and then CT imaging is acquired and reconstruction begins, normally about 60 seconds. While CT reconstruction complete, the patient is automatically positioned for the PET imaging, and then PET attenuation correction factors are computed. Usually 7 to 8 bed positions are acquired for each patient during whole body PET acquisition, starting from type end of the table. F Choline PET CT scan is a useful imaging modality in patients with prostate carcinoma for demonstrating the spread of the disease preoperatively and to detect local recurrent disease after radical prostatectomy. Radiotracing administration, 18F choline, a radiative compound that targets cellular membrane synthesis, is injected intravenously. Choline is taken up by the cell with increased membrane turnover, such as cancer cells. The uptake period is relatively short, typically around 5 to 10 minutes, as 18F choline is rapidly incorporated into cells. F choline PET CT scan have similar positioning and procedure like FDG scan. The scanning time may vary, often initiated shortly after injection due to rapid choline uptake, and the total scan time depends on the specific area of interest. For example, pelvis for prostate cancer. FDG showing high uptake in metabolically active tissues such as brain, heart, and kidneys. For pathological uptake, it identifies hypermetabolic activity in tumors and inflammatory processes. Normal physiological uptake noted in the brain, myocardium, liver, and bladder. For example, in the figure A, baseline 18 FDG PET images in advanced colorectal cancer patient, showing a multiple lung, liver, and lymph node metastasis. This is an example of radiographic appearances for PET CT scan. The PET CT scan showing an intense FDG uptake in the vulva, consistent with a known primary malignancy, right pelvic side wall, external iliac nodal site, and bilateral groins all exhibit FDG with metastatic lymphadenopathy. There is possible metastatic adenopathy in the bilateral right greater than left axillary rhexis versus reactive nodes. Non-specific increased FDG uptake within the gastroesophageal junction, and the focal area of intense FDG uptake in the spinal canal at the level of T11 to T12 level is indeterminate in the absence of other CNS diseases. This is an example of radiographic appearances of PET CT scan using 18F choline. The 18F choline shows uptake in organs with high cell membranes turnover, such as prostate, liver, and pancreas. The pathological uptake it shows highlights of areas of high proliferation, such as cancerous tissues, and then 18F choline also having less background activity in brain compared to FDG, providing a clearer image for certain brain tumors. And then we can see at the image B, the image showing a prostate specific antigen values after radical surgery for prostate cancer. The patient was also surgically treated for lung cancer, and then maximum intensity projection and axial of the 18F choline show an area of focal radiopharmaceutical uptake in the right lung, subsequently proven to be non-small cell lung cancer. And finally, this is an example of radiographic appearances of combined imaging using the PET CT scanner. We can see the figure A, there's a sagittal fused image, and B, maximum intensity projection. MIP showed several skeletal PCA pathological uptake, post-treatment 18F choline, PET scan, and then C is maximum intensity projection, and D is sagittal fused image performed after radium-223 therapy show a significant reduction of metastatic bone uptakes.